Hello, my name is David Trimberger, and this is attempt number 2 at IV Piggyback administration. So the first thing that I'm going to do is gather up all my materials, which will include tape, my medication labels, my medication that's going into my piggyback solution, tubing, and a sharps container. The first thing that I'm going to do is speak with my patient. First thing that I'm going to do is check with my patient. So I am going to check my medication orders, and then as I walk in, I am going to ask them to tell me their name and their date of birth, making sure that it matches up with their medication label. After they have told me all these things, I'm then going to ask them if they have any known allergies to medications. After I find that out, I will then grab my medication. I am going to go through my 5 rights. So I'm going to have since my patient already told me their name and their date of birth, I now know that I have the right patient. I'm going to make sure that this is the right medication, that I have the correct dosage of it, that I can give this through an IV, and that I'm giving this at the right time. I'm also going to check the expiration date and the clarity of the medication. I will then draw my medication up and assemble it, and then make sure that I have all of my air bubbles removed out of my syringe, attach my needle, set that aside. Then I'll come over and I will grab my IV solution. I will check to make sure that this is the correct solution, that I check the expiration date, the clarity of it, and that it has both of its that has both of its tail ports. I'm going to grab my IV tubing, check to make sure that it has both of its tail port covers, that this is the proper drip rating. I have my flow clamp all the way up as close as I can to the fill chamber, and that it is closed off, and that there are no kinks or twists in my tubing. I'm then going to place proper PPE. I'm going to open up an alcohol prep pad and then clean off my secondary injection site on my IV. Then I'm going to check my medication one more time. Then I'm going to administer my medication. Then I'm going to immediately put this in my sharps container. Going to gently mix up my medication. Okay, after I've done that, I'm then going to spike my bag. Fill my fill chamber up about halfway. Then I'm going to get all of my air bubbles out and try and minimally not waste any medication. Okay, I don't see any more. I will then come over and hang my IV bag. After I have done all of this, I'm going to clean up my area a little bit. I will then come over to my main line and I will turn off its drip rate. I will grab my a new alcohol prep pad, and I will clean the Y hub. I will inspect my medication one more time, making sure that this is the correct medication. I will then attach my IV solution to my primary line. I will take tape and I will tape it to my primary line. I'll tape it to my primary line, and then I will next I will open up my secondary line, get it set to the proper drip rate, open up my primary line, make sure that it's set to the proper drip rate. And then also, as I was setting up this administration set, I would want to make sure that my piggyback is higher than my main line. After I've completed all of that, I'll make sure that I have attached my label. to my piggyback medication, and then I'm going to monitor my patient for any adverse side effects, any adverse reactions, undesired side effects, and then making sure that they are sticking with their therapeutic response. Thank you.